Are there signs we should look for in family and friends? For that, let's go to psychiatrist Dr. Henry Paul. He joins me from New York. Dr. Paul, I'll be very open. As someone who has had a family member who has committed suicide, I know it's very difficult to answer that question about whether or not there are signs to look for because you don't always know. But let's go ahead and try to tackle that question. What can you look for in people that you know?
Well, it's, of course, not 100% feasible to always know when someone's going to commit suicide, but there are some general markers for suicidal behavior. Number one is, of course, depression. But not only depression, because, of course, the majority of people with depression never commit suicide, although some have suicidal thoughts, but it's depression with a certain tinge of hopelessness involved, where when you speak to the person, you get a feeling that he's given up. And it's that hopelessness factor which is the greatest predictor of suicide. In this particular case, I might say I've read, and I don't know, I've never met Mr. Scott, and I don't know his history, but I've read a couple of internet stories that he was recently diagnosed with the recurrence of cancer. I don't know whether that's true, but if it's true, a recurrence of cancer is a very demoralizing and depressing thing, especially if one has fought the disease before. Often patients feel that they're at ground zero again, back to the beginning and fighting again, and that might be very demoralizing. So if that's true, that's a risk factor. As a matter of fact, cancer in general tends to raise the risk of cancer. In addition to depression, as mentioned before, the substance abuse and alcoholism, a family history of suicide, a family history of violence, being exposed actually to suicidal behavior in other members of the family is often a modeling phenomenon that takes place. But most of all, it's depression. Some people with schizophrenia have a higher rate of suicide, but nothing comes close to the diagnosis that of depression for predicting suicidal acts and completed suicides.
Doctor, you know, he had a wife, he had twin sons, he had an extremely successful career. Yes. Sometimes when someone feels like, everyone thinks that I have everything to live for, are those the kind of people that sometimes don't go get help because they feel like people think I have everything?
Well, we don't know whether he wasn't getting help, number one, but number two...
well, I just mean in general, beyond just him. I'm talking about in general.
The suicide in general spares no family and spares, we're all vulnerable to mental illness, and of course mental illness itself sets us up, any mental illness sets us up for an increased possibility of suicide. But people who have everything, so to speak, and lovely families, he had, I think, two 12-year-old twins and a third wife, with whom he was well-adjusted, supposedly. It doesn't protect us, although psychosocial circumstances do, in general, afford some immunity from suicide. The poorer you are, the more you're struggling in this economy. I'm sure the suicide rate has gone slightly up in those depressed areas of the country. So in some way it protects you, but not necessarily. We don't really know what was going on in his mind, but the fact that he has a family and left a note and didn't really speak with them, to me implies some degree of impulsivity to the act, not a well-planned suicide. So it almost has a feeling of a last-minute phenomenon, that he quickly wrote the note and was suffering so terribly from something that he committed this act.
It's profoundly, profoundly sad. Profoundly sad. Dr. Henry Paul, thank you very much.
Thanks for having me.
Of course, Showbiz Tonight will have